cholinergic antagonist. These are also known by other terms like parasympatholytics and anticholinergics. These medications or these drugs actually block the cholineceptors, and these cholineceptors are of two types in our body: nicotinic and muscarinic. Nicotinic, further they are divided into nicotinic neuronal type, nicotinic muscle type, and muscarinic are further divided into M1, M2, M3, M4 and M5. There are 5 types, and we have already discussed the further explanation of these receptors in our previous videos. So in this video we will just talk about the pharmacology, that how the medications are acting on these receptors. Before we move towards pharmacology, let us understand a little bit about the parasympathetic nervous system. You know, the cranial and sacral region, these are the region from where the parasympathetic nerves originate, and then they are controlling different organs in our body. So let's start from the eye. What is the effect of parasympathetic nervous system on the eye? You know, parasympathetic nervous system, this is also known by the system of rest and digest. So when we are just in a resting condition, this system is actually controlling our body. So how will it affect our body? Starting from the eye, parasympathetic nervous system will cause the constriction of the pupil. So pupilloconstriction will happen, and coming towards the mouth, when you are in the rest condition, saliva starts forming. So salivation, lacrimation, urination, defecation, these all secretions are supposed to happen when you are taking rest, or you can say when your body is being controlled by the parasympathetic nervous system. So then we have the lungs. Parasympathetic nervous system stimulates the lungs to constrict the bronchiole and to increase the secretion. You know, when we are in rest condition, we don't need to inhale or exhale in a quick manner. We do not need to inhale or exhale much air. So for that purpose, the parasympathetic nervous system will stimulate the lungs to constrict the bronchioles and to increase the secretion. And parasympathetic nervous system maintains the normal heartbeat of the heart. And the parasympathetic nervous system increases the GIT motility, and due to which defecation will also be happen. So increased defecation and increased urination will be seen in the parasympathetic nervous system controlled way. So when we take these medications, these will actually alter these mechanism. So what happened in the beginning? The pupil size of the eye decreased, which is also called as miosis, and the anticholinergics will cause the mydriasis. Parasympathetic was constricting the bronchioles and increasing the secretion, whereas anticholinergics will increase the dilation and decrease the secretion. The parasympathetic nervous system was maintaining the heart rate, and the anticholinergics will increase the heart rate. And parasympathetic nervous system was increasing the GIT motility and defecation along with the urination. And now our anticholinergics, they will cause the decrease in GIT motility, will cause the constipation, and will cause the retention of urine. So they will be decreased in urination. So this is actually the general way of anticholinergics action on the parasympathetic nervous system. Coming towards the pharmacology, the very first one, anti-nicotinics. We have 2 types: nicotinic neuronal type, nicotinic muscle type receptors. So due to which we also have 2 types of drugs. So the very first one, nicotinic neuronal type, we were supposed to block the nicotinic neuronal receptors. So they are actually present in the ganglia, due to which these drugs which are blocking the nicotinic neuronal receptor, they are known as ganglionic blockers. An example of the drug is nicotine. So now where is our ganglia, or where is our nicotinic receptor? Nicotinic receptor, this is the ganglia, presynaptic neuron and postsynaptic neuron. They meet together outside the central nervous system. Here the vesicle is formed. This is actually known as ganglia. And here's our nicotinic receptor neuronal type. So when we take nicotine, this will actually block the nicotinic receptor, will inhibit the nicotinic receptor. And the mechanism of action is a bit different because it is dose dependent. When you take the nicotine, here is the receptor of the nicotine. So when we take nicotine in low doses, it will come and will bind here. It will stimulate. In low doses, it will stimulate these receptors, and which will cause the depolarization. And you know, when the neuron is depolarized, it is supposed to forward the signal. And nicotinic effect seen in our body are, it will increase the heart rate when we give it in low doses. It will increase the GIT motility. It will increase the urination. So you can say defecation, GIT motility, heart rate and blood pressure, these all are increased when we give it in low dose, or when we take nicotine in low doses. And if we take the nicotine in high dose, now this was the condition of low dose. When we take in high dose, these nicotinic receptors will actually be blocked by this nicotine. These will be desensitized. When time and again a receptor is stimulated, then that receptor will become desensitized, will no more receive the signal from these specific chemical. Now this nicotine will no more be able to stimulate this nicotinic receptor. So this nicotinic receptor will become desensitized, and due to which what will happen, signal will not be given to the cells, and the cells will not activate. When the cells are not activated, so neurons will not send the signal. Then what will happen? Before it was supposed to increase at low doses, but now it will decrease the heart rate, it will decrease the secretion, it will decrease the GI2 mortality, so which will cause the constipation, it will decrease the urination, so it will cause the urinary retention. So at high doses it will cause a positive effect as compared to low doses. Once again, when we take nicotine at low doses, it will stimulate the receptor and will cause the depolarization, due to which what will happen, the heart rate will increase. When we take nicotine, nicotine has effect on heart. So heart rate will increase, blood pressure will increase, secretions in the body will increase, GIT mortality will increase, defecation will increase, and urination will also be increased. But when we take nicotine at high doses, at high doses, these nicotine will stimulate time and again our receptors, and the receptors will become desensitized. The signals that were supposed to be given to the heart will be decreased. So heart rate will be decreased at high doses, and the GI2 mortality will be decreased, secretion will be decreased, blood pressure will be decreased. So that is how our nicotine is acting at low and high doses on the nicotinic receptors. Coming to the next one. Next nicotinic is a nicotinic muscle type. Now this was nicotinic neuronal type receptor. Nicotinic muscle type receptor is present on the muscles. Here is our muscle. Consider it as a muscle. So on the muscles we have nicotinic muscle type receptor. This is nicotinic receptor present on the muscle, due to which it is called as nicotinic muscle. What happens next is that we know nicotinic muscle type receptors, they are actually controlled by two types of medications. One is depolarizers, another one is non-depolarizers. Depolarizers, example is succinylcholine, and its mechanism of action is based on the phases, phase 1 and phase 2. So first we'll clear nicotinic muscle depolarizers, then we will move for the nicotinic muscles non-depolarizers. So depolarizers like succinylcholine, and its mechanism of action is based on phase 1 and phase 2. So consider here succinylcholine. When succinylcholine comes and binds to the nicotinic receptors on the muscle, so this succinylcholine will bind to the nicotinic receptor which is present on the muscle in two phases. Let me make people clear here. When succinylcholine comes and binds to the receptor, this one, nicotinic muscle receptor, so it is actually acting in two phases. In first phase, it will bind to the receptor, it will stimulate the receptor. What will happen? The ion channel will open and the ions will move inside, and the depolarization will be caused. So when succinylcholine binds in first phase, it causes depolarization, so contraction will be seen in the first phase. In the first phase, contraction will be seen. In the second phase, when succinylcholine comes and binds, so when there is an increased amount or increased concentration of succinylcholine binding on these nicotinic receptors which are present on the muscles, then these receptors will become desensitized. We discussed a moment earlier, when a receptor is stimulated time and again by a specific ligand, drug or neurotransmitter, then that receptor will become desensitized. So means its sensitivity will be lost. Now succinylcholine, when it is coming and binding to this receptor, the receptor will no more show its action, and in meanwhile this receptor will start doing the repolarization. So two mechanisms are happening. One is that desensitization of a receptor, second is repolarization, means the cell is moving back towards the resting state. So when we take succinylcholine, it will do its action in two phases, phase 1 and phase 2. In phase 1, it will cause the depolarization and muscles contraction will be seen. In phase 2, it will cause the desensitization, and due to which then the signal will not be given to the muscles for the contraction, so muscles relaxation will be seen. Like this, our succinylcholine is causing the muscle relaxation in two phases. In the first phase, it is causing the depolarization, a slight muscle contraction. In the second phase, it is causing the receptors desensitization, and when the receptors are desensitized, then the signal for the contraction to the muscles is not given, due to which what will happen, the muscles will relax. So we can say in a nutshell that our succinylcholine, which is an M blocker, nicotinic receptor blocker, so which is anti-nicotinic, this will actually cause the muscle relaxation. Which one? Our depolarizers, succinylcholine. Non-depolarizers like tubocuarine, these are also causing the muscle relaxations, but in a different way. Why? Because its mechanism of action is different. It is non-depolarizer, so tubocuarine is acting like in a competitive way, means it will do competitive inhibition. Suppose here is your acetylcholine and here is our tubocuarine, which is a non-depolarizers. So its mechanism of action is other than this one, different. Like how? It will compete with acetylcholine. So it will come and will bind to the nicotinic muscle receptor. Now acetylcholine will no more be able to bind here. So due to which what will happen? Tubocuarine will block the nicotinic receptor which is present on the muscle. When this receptor is blocked by the tubocuarine, then acetylcholine will not stimulate the cell to contract. So due to tubocuarine, what will happen? Then the muscle will become relaxed. So why it is becoming relaxed? The reason behind is because this receptor is now blocked. So when receptor is blocked, then the signal for the contraction is not given to the muscle cells, due to which what will happen? The muscles will relax. So tubocuarine and succinylcholine, these both are causing the muscle relaxation, and we call these as muscle relaxants. And these muscle relaxants are often used when we're going for surgery. Coming to the next one, that is the antimuscarinics. We have two types, natural and synthetic. The natural antimuscarinics we have, that is atropine and scopolamine. Atropine, the scopolamine, these both are derived from natural source, means from plants. Their mode of action or their effect is seen on different organs of the body. The reason behind is their structure, which is actually a tertiary amine structure, due to which it can diffuse in the body. When we take atropine, it will just antagonize the functions of the parasympathetic nervous system on the eye, on the lungs, on the heart, on the GIT, on the urinary system. So parasympathetic nervous system was causing the pupilloconstriction, or you can say meiosis, and atropine will cause the mydriasis. And PNS was causing bronchoconstriction and the secretion, and atropine will cause the bronchodilation and decrease in secretion. And parasympathetic nervous system was maintaining the heart rate, whereas our atropine, which is a dose dependent medication, at low doses it will decrease the heart rate, but when you give atropine at high doses, it will increase the heart rate. PNS was causing the GIT motility to increase defecation, and atropine will cause decreased GIT motility and decreased defecation. PNS was increasing the urination, and atropine will cause decreasing the urination, or it will, you can say, it will cause retention of the urine. And the next one is scopolamine. Its mode of action is seen both in the CNS and GIT, and now more often it is used for the anti-motion sickness purposes. The next one we here study is that synthetic antimuscarinics, that are apratropium and thiotropium. The PNS, parasympathetic nervous system, is supposed to cause the bronchoconstriction and increase mucus secretion, whereas these are antimuscarinics, which are synthetically prepared, like ipratropium and thiotropium. These will counter the parasympathetic nervous system supply, so it will cause the bronchodilation and decreased mucus secretion. So then why are we getting both? The reason behind is half-life. Ipratropium can be given 4 times a day, whereas thiotropium can be given once a day. And these are mainly indicated for the COPD patients, like chronic obstructive pulmonary disease patient,